joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along. Also happy to be joined this afternoon, as always, by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media in attendance this afternoon, and a reminder that if you do have questions, you can submit them using the question form here on Microsoft Teams. Just click on the question mark text bubble, and when you submit your question, if you could indicate your name as well as your media outlet and who your question is for. Finally, a greeting this afternoon and welcome to those who are tuning in on Rogers Television as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are watching on the CTV London website. Let's begin with our opening remarks, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan. Good afternoon, everyone. First, let me wish a happy and blessed Eid Mubarak to all of my Muslim brothers and sisters, because here in London, Middlesex, and around the world, we celebrate this very special occasion. I have every confidence that next year we'll be celebrating this blessed occasion together and in person. The only way that happens, aside from wearing a mask, physically distancing, not having friends over and washing your hands, is through the successful completion of our historic, unprecedented and ongoing vaccination efforts. Look, we're at a point where now we're almost 50% of all adults in London Middlesex have received at least one shot. We've had incredible uptake of vaccines to date. We want to see that momentum not only continue, we want to see it build even further as our supply of vaccine continues to grow. I'd like to speak directly for a moment to thousands of Londoners who received the AstraZeneca shot. I know the announcement earlier this week from the province has caused some confusion, frustration, and deep concern among some. I suspect further and specific guidance from the province will come in short order with respect to second doses, whether that be a second dose of AstraZeneca or another vaccine. However, in the temporary absence of that confirmation, if you received an AstraZeneca vaccine, I'd like to say thank you. I want you to know you did the right thing. This vaccine is highly effective. You not only protected yourself, you protected other people, and you saved lives in the process. You've made a significant contribution towards ensuring a safe and faster reopening of our society. You've received the same vaccine as millions of other Canadians, including our Prime Minister and our Premier. They too were vaccinated with AstraZeneca. Once again, I appreciate the concern surrounding what happens with your second shot. And as we await specifics from the province, I'd like you to know this week's announcement will neither delay your access to a second shot, nor will it be any less safe. But most of all, as mentioned earlier, I want to make it clear, you did the right thing. You made the right choice. And for that, I thank you. Speaking of thanks, I'd like to also recognize dozens of City of London staff for their great work with the health unit, preparing and ultimately helping to operate our fourth mass vaccination clinic at Nichols Arena. Appointments started being filled at 8 o'clock this morning, and the clinic itself will open on May 25th. This is a significant milestone and monumental step forward in our efforts to crush this virus locally. And I'd like to recognize the work of the City of London staff and the health unit. You stood tall and stepped up to ensure the successful operation of this clinic. So again, I get to say thank you. Quickly and finally, an update on enforcement. We've charged 2 individuals for malware in connection with the so-called freedom protest in Victoria Park back in late March. These are in addition to 2 other individuals who have already been charged. I think it's important for the public to know that sometimes these investigations take time. And so just because charges aren't laid right away doesn't mean they're not coming. So with that, I've done a lot of thanks, and it's from my heart. Let me say thank you, Dr. Mackie. I'll pass it to you now.
Thank you very much, Mr. Mayor. I want to start with acknowledging the comments that you made around those that chose to seek an AstraZeneca vaccine. It was a great decision. It remains a great decision. You protected yourself at a time when the virus was circulating intensely in our community, and it still is. And that protection will help you, it will help your family, it will help our community. So the announcement that Ontario is pausing rollout of first doses of AstraZeneca is really based on a relatively small amount of new information. In the 650,000 vaccinations or so, we would have expected about 7 cases of blood clots. Instead, there's probably around 8 to 11. We're still confirming some of those it doesn't really materially change the risk level. One thing that is different now is we have a much better supply of Pfizer vaccine that is much more widely available. And so that means that anyone that is still seeking a vaccine is able to get one of those mRNA vaccines either right away or very soon as eligibility opens up. And I think that made it, much easier to pause the AstraZeneca first dose rollout. The other important thing to remember is that, to think about, is that those who received AstraZeneca will receive a second dose, whether it's AstraZeneca or, as we gather more data from trials around the world, it may be that they get a second dose of a different vaccine. As that research is conducted, we may find that a second dose from a different vaccine is even more effective. If that's the case, there will be lots of Pfizer around to make sure that people get those second boosters of a different vaccine if the research shows it's appropriate. On the case fronts today, just 80 cases and no deaths. It's really pulling our average down below 100 cases a day, which is a big milestone, and provincial numbers looking good as well, continuing to trend down. On the vaccine front, 40 plus opens up today, big day. We've already had over 5,000 people book. We had 17,000 people book within about 24 hours on Tuesday when we opened up to everybody with those high-risk health conditions, as well as the essential workers group 2. That was a banner day, biggest booking day we've had, and basically no hiccups. There was a bit of a wait time as the website is designed to produce when there's a high flow, but that was really only about 15 minutes wait, and people got their appointments. So that's tremendous. We still have appointments available in the system. The other availability right now is with the Nichols Arena. Earl Nichols Community Center has been opened up in the booking system. We won't be opening this facility physically until the 25th of May, but in order to make sure when it opens it's booked, we have those appointments available in the system. And if someone still has yet to book, as we open up to the people that are age 40 and above and all of the other eligibility groups, if you have an appointment still to book, go to Nichols first. The new appointments in Nichols are the earliest. As of about an hour ago, there were still appointments available on the 26th of May at the Earl Nichols Arena. We will be moving at this point to 30 plus as of next Thursday and 18 plus the following Thursday. That is still pending provincial confirmation, but we have no reason to believe that we'll have to change those dates. So that will be, as of 2 weeks from now, every adult in Middlesex and London will be eligible to book their vaccine appointments. And very grateful to everyone who has already done so. And I'll pause there in case there are questions.
Thank you very much, Dr. Mackie, and thank you, Mayor Holder. Yes, there are questions. I can confirm that. And if you are joining us as a member of the media and you do have a question, please do submit it. We have a shorter than usual question queue so far. So if you've just been waiting for your opportunity to get a question in, now would be the time. Let's go to the questions right now. We'll start this afternoon with Jennifer Beeman at the London Free Press. Dr. Mackie, this question is for you. Dr. Mackie, with the province aiming to make the vaccine available to those 12 to 17 years old on the week of May the 31st, will the health unit be tailoring its vaccine rollout to reach this target group, such as partnering with school boards for pop-up clinics or asking the boards to reach out to families?
Yeah, absolutely. We certainly intend to partner with school boards on this. We don't necessarily intend to have a school by school campaign. We do with other vaccines every year, hepatitis B, HPV, go school by school. And it takes us about 3 months to get our vaccine teams into every school to make sure, and that's just high schools and middle schools. So the idea that this would be going out in partnership with school boards is really more of a partnership. There may be situations where we do set up a clinic in a school, but at this stage in the campaign, the mass clinics are still by far the most efficient and effective way to get the vaccine into arms. And we want to get those vaccines, at least first doses, in by the end of June, if we can, based on supply. And it really wouldn't be, a school by school campaign really wouldn't be a way of meeting that goal. So looking forward to working with the school boards. We haven't yet established exactly what that looks like, and we'll have more information as soon as we can.
Thank you very much. Let's go to another question from Jen Beeman for you, Dr. Mackie. We go from the 12 to 17 age group to now younger than 12. Dr. Mackie, vaccine trials are underway in younger children. Would you expect the vaccine will be made available to children under the age of 12 in Ontario in time for when school goes back in September?
Great question, Jennifer. We don't have information at this point about whether vaccine will be available for those under 12 before September. Certainly hope so, but we don't have that at this point.
Another question from Jennifer Beeman, Dr. Mackie. This is the final week of the province's 50% hotspot vaccine allocation. Do we have a sense of how many doses the health unit is expecting to receive next week?
Yeah, we do. It's in the range of 25,000 doses of Pfizer. I don't remember the exact number off the top of my head, but it is a big jump. So we will be catching up quickly in terms of doses per capita administered in this region. And we've already planned for those in our vaccine booking system. So that is already, mostly booked out for the next few weeks.
Thank you, Dr. Mackie. And let's go to, Jen does have a couple of more questions. Dr. Mackie, is the health unit developing another way for high priority healthcare workers to bump up their second dose appointments? So I'm thinking reducing the interval between the first and second dose, instead of just using the phone line?
Yeah, so as of last Friday, healthcare workers could book, certain healthcare workers, it's a small subset defined by the province, could book their second vaccine doses earlier than the 4 months we had been booking out. That's a new announcement, and we are using the phone lines. That is the plan for the foreseeable future. The booking system online is really focused at getting first doses into arms. We've also had a chance, I did some analysis on state level data. There are easily obtainable online. You can look at the cases, hospitalizations, deaths, percent positivity in the 50 states, and then compare with their vaccine campaign numbers in terms of how many people have received first doses and how many people have received second doses. The relationship between cases, hospitalizations, and deaths is much stronger with those first doses. It seems, especially when you get above 50% in the 55 to 60% range, that level of vaccination for first doses has a way stronger impact on reducing cases, hospitalizations, deaths, percent positivity across those 50 states. If you compare with second doses, it really doesn't have nearly as much impact. In fact, the data on those 50 states doesn't show a strong impact at all on the second doses. It really is the first doses that are the most important for stopping spread in the community, and that's where we're focusing our efforts.
Thank you, Dr. Mackie. Jen does have another question. We're going to get to this one from Jennifer Beeman again at the London Free Press. Dr. Mackie, is the health unit planning another mass vaccination site? And again, the announcement yesterday that the Nichols Arena vaccination site would be opening on the 25th of May. Is the health unit planning another mass vaccination site, or will the next phase of the rollout involve shorter-term pop-up clinics and mobile team deployment to target areas?
All of the above, Jennifer. We're certainly planning to have a fifth max.
No, I think we may have Dr. Mackie's
pop-up clinics, more mobile team deployment, more targeting to specific neighborhoods. We're also planning more rollout of vaccine through primary care, family doctors' offices, and of course, there will be a lot more going through pharmacies as well. It looks like over the next few weeks, the province is really going to ramp up delivery of Moderna through pharmacies, so that's very encouraging as well.
Thank you very much. Next question comes to us from Wendy Spence from the Dorchester Signpost. Dr. Mackie, during his announcement earlier today, Premier Ford mentioned that there are vaccine-resistant variants. Are vaccines in development for the various variants?
That was a real tongue twister, but you handled it beautifully, Dan.
Thank you.
So thank you for the question. Some of the vaccines that we're currently using are easier to adjust in terms of affecting the variants. I believe the Johnson & Johnson is one of those. At this point, the variants that are resistant to vaccine are a small part of the picture. We're not seeing many of those in Canada or Ontario, certainly not in this region. The vaccine is very effective against most of the variants, almost all of the variants essentially we're seeing in Canada. And so we're absolutely focused on getting this vaccine into arms to stop the current pandemic that we have.
Thank you very much. The next question comes to us from Ashley Goveas at the Western Gazette. Dr. Mackie, is the health unit planning to partner with post-secondary institutions to vaccinate students, similar to the idea of London's school boards? And that, of course, after the 18 and over eligibility opens up in the next 2 weeks.
Yeah, great question. I know, Ashley, that Western University is keen to have their students vaccinated, so definitely we'll be working with them. Again, in the next few weeks, even the next couple of months, mass clinics will remain the largest part of our distribution system. They are the most efficient and effective, and they're proving, very effective at getting our vaccination rates up across the population right now.
Thank you very much, Dr. Mackie. And again, a reminder that if you do have a question and you've been waiting to submit it, now would be a great time to get it in, as we are getting to the end of the questions that we have lined up for this afternoon's briefing. The next question, Dr. Mackie, this one is for you again from Jennifer Beeman. Dr. Mackie, how will vaccinating the 12 to 17-year-old age group be for stopping cases linked to schools?
Yeah, it'll definitely be a factor, Jennifer. Most of the cases that we've seen in schools in this region have come through family members, adults who are out in the workplace and bring a case of COVID home. And so vaccinating the adult population is strategy number one to protecting children. And then, of course, once we've been able to move through that, we hope to be able to vaccinate those in the 12 to 17-year-old age group, and that will help with the school cases as well.
Thank you very much. And there we got another couple of questions that just came in. I think Jennifer is trying to get a scoop here, Dr. Mackie. She's asking, where would the 5th mass vaccination center be located? In the City of London or possibly in Middlesex County?
I'm going to have to stick with yes at this point, Jennifer. We won't be able to announce the location of the 5th clinic at this point.
And right now, our final question, Mayor Holder, this one is for you. It comes to us from Jacqueline LaBelle at Global News Radio 980 CFPL. Mayor Holder, do you have any comment on the news that Greyhound will be ceasing operations, in particular, what impact this may have in the region, especially in more rural areas?
Well, thanks for the question, Jacqueline. It's timely as well. Certainly from our standpoint, any operation, and Greyhound has been an important contributor to regional transit for years and years. It's why the Minister of Transportation provincially asked me to chair the Southwest Ontario Task Force. And I can tell you that one of the major areas that we are looking at is intercity transfers and how that works. We have local partners like Voyago that are involved in some of that to this point. We're also talking with Via Rail. They've approached me in terms of how they can use their services to support our region's needs. I think the whole issue of how various cities in Southwestern Ontario are connected, and typically busing has been a very traditional way. There may well be some other options, and over the next few months, we're going to be investigating that very, very heavily to see what the best approach is going to be. It's a serious issue, one that we don't take lightly, and I will tell you that more information will come as recommendations are made through this committee, which, by the way, is made up of 10 regional mayors and several of our First Nations. And so as a result, it was interesting that when we approached these participants, all enthusiastically said they wanted to support the effort. And the most significant response in terms of wanting to be involved was the issue around intercity transfers. So I would say to you, it's very top of mind to us, very top of mind to the province. I would look forward to us making some pretty serious recommendations in the months to come. I would imagine likely that we will be making our report to the province in mid-fall, and at which time the province will work with us to ensure that the connectivity that we have between our cities and towns throughout southwestern Ontario is maintained.
Thank you very much, Mayor Holder. And yes, that news, that announcement coming early this afternoon about Greyhound. So thank you for addressing that. And thank you both, Mayor Holder and Dr. Mackie, for your time, your insights, and your information as always on these virtual media briefings. A big thank you to the media who joined us as well this afternoon, and those who are tuning in on the radio and on television and online. That will do it for this afternoon. We'll be back with our next virtual media briefing coming up next Monday at 2 p.m. So we hope to see you then. Between now and next week, have a great weekend. Have a great rest of your afternoon, and so long for now.